Hi, I'm Dr. Robert McLean. I'm a spine surgeon here in Cleveland, Ohio, and I want to talk to you today about your back and your neck, what you can do to keep them healthy and fit, and what your doctors can do when they're not. Today, I'd like to talk about spinal fusion. What is it? What does it do? And when is it the right choice for you? Now, whether you're just curious and thought this topic might be interesting, or you're a patient with a real problem and you're looking for help, I hope you'll find today's talk helpful and informative. Now, if you've seen one of my previous talks, you'll know that disc arthroplasty or disc replacement is something I'm very enthusiastic about. It's a motion-preserving operation that works great for certain kinds of problems in certain patients. Today, I need to talk to you about when spinal fusion is necessary, why it's necessary in some cases, and why it's one of our most important tools. When there's severe degenerative disc disease causing neck or back pain, deformity, instability, or if there's been a fracture, or even a more serious problem like an infection or a tumor, instability develops that causes abnormal motion, severe pain, and can cause real serious problems with respect to nerves. When that happens, spinal fusion is necessary. The important thing to know is that when it's done right, for the right reasons, fusion is highly effective and reliable at relieving pain and getting you back to an active, full life. When do you need to have surgery? And more specifically, when should your doctor recommend a spinal fusion for you? Well, there are a lot of different problems that affect the back and neck that can cause severe pain, sometimes neck pain, sometimes back pain, sometimes arm or leg pain. But a lot of these problems don't require surgical treatment. If you have a muscle spasm, for instance, or muscle injury, you get pain and you can get stiffness and a lot of dysfunction. But there's no need to think about surgery in those kinds of circumstances. Physical therapy, ice, heat, anti-inflammatories, all of those things work together to help you recover naturally from the process. 9 times out of 10, non-operative care gets you back to good function and out of pain. And that includes some problems like disc herniations. Many disc herniations will get better without having to have surgery. But there are some conditions where no matter what kind of physical therapy, what kind of medical treatment you get, you're just not going to get better without surgical treatment. And in some of those cases, fusion is the best treatment and a necessary part of the treatment process. The kinds of problems that we usually use fusion for include problems of stability of the spine, whether there's a lot of arthritis that has caused bones to shift out of alignment, whether there's a deformity problem like a scoliosis or an actual shift of the vertebrae, or when the discs have degenerated to a point where they just aren't holding the spine together in an alignment that is safe and comfortable, or when we're trying to correct a deformity like the scoliosis. In those cases, fusion surgery gives us the chance to eliminate abnormal motion, which can eliminate the painful process, and correct alignment so that the rest of the spine functions normally and so that our back biomechanics and our hip and pelvic biomechanics get back to normal and get back to good function. Now, we lose some motion when we have a fusion surgery. The discs that used to move won't move anymore, but if we improve the patient's pain, if we reduce pain, patient's actual ability to move and bend and twist improves. So fusion stiffens one part of the spine, but it doesn't change our ability to move and bend and twist as an individual. Now, what is fusion? Fusion is a process by which we get two bones to grow together into one. It's the same process that our body uses to heal a fracture. When you break a bone, there are chemical and signals within the bone that get the bone to grow back together and heal. And that process involves chemicals that we also can stimulate when we do a fusion surgery. By removing some portions of the outer layer of a bone and placing bone graft in the area, we use the body's normal repair process to get one vertebrae to heal to the next one, to stiffen the spine and stop the spinal elements from moving abnormally, from moving in an abnormal and painful way. To hold that alignment, we often do use spinal instrumentation. In other words, it might be rods and screws or a plate and screws. And your doctor may talk to you about using certain kinds of spinal instrumentation to stabilize the spine. But that instrumentation, that material that we put in the body with the bone, the screws and the rods, that's there to hold the bones in place until the fusion takes place, because that's what's going to hold you in good alignment for the next 40 or 50 years. Now, there are some circumstances where fusion is important because of the surgery we're doing and not because of a pre-existing part of the problem. There are different issues that can affect nerves in terms of disc herniation or what we call stenosis, where there's narrowing around the spine, where we have to take away a lot of bone in order to take the pressure off the nerves and restore neural function or to protect the spinal cord. There are also other kinds of more serious problems like tumors, like infections, and trauma, fractured bones, where we have to go in and remove bone or remove a lot of tissue in some cases to protect the spine or correct or cure the disease. In those kind of circumstances, fusion is absolutely necessary to restore the stability of the spine, get it back in good alignment, and then hold it there so that the patient can recover from the overall process and get back to good function. So spinal fusion is very important in certain kinds of decompression surgery, and we know that the patient's going to have problems if we don't do it. So your surgeon may say, we need to do this procedure to take the pressure off the nerves, and after that, we're going to need to do a fusion. If we know that the remaining bone can't resist normal loads and stresses and can't protect the spinal cord anymore, then fusion is really necessary to restore a strong spinal column and allow a return to full activity and function. Okay, so how do we do a fusion? Now, it's important to know that there are several different ways to perform a fusion surgery. Two different surgeons, both really qualified surgeons, may recommend fusing the same levels to treat the same problem, but they may recommend very different approaches or different kinds of implants and procedures to get that job done. One surgeon might recommend a posterior approach where we go at the back from right in the middle from behind and expose the back of the spine. And another may suggest going through the abdomen or through the chest to get to the front of the spine. Now, their goal may be the same, to fuse the spine and correct a certain problem, but they may find that in your case, different problems make one approach a little bit better than the other in their mind. Now, that can be pretty confusing to the patient, and you may wonder why one doctor would recommend doing things one way versus the other. But remember, it's okay to ask those questions and find out why one approach might be the best for you. So when we talk about approaches, we talk about how we're going to go after the spine, whether we come through a posterior approach, coming at the spine from behind, or an anterior approach. So let's look at the model and talk about how we approach the cervical spine, in this case, from posterior or anterior surgical approaches. When we're talking about our approaches to the spine, I mentioned that a posterior approach comes from the back, from behind. The anterior approach means we're coming at things from the front. So the front of your neck sits up here where you can see the discs and the vertebral bodies. Everything in your real body sits in front of here, your throat, your esophagus, your trachea. But in the approach to the spine, we're able to move those tissues out of the way so we can get at the spine from the front. When we're approaching the spine from behind, all the big muscles of the neck or all the big muscles of the back are laying over the top of this bone and attaching to these bony prominences. These are the spinous processes. And taking the bone, the muscle away to either side allows us to get at the back of the spine. Now in the cervical spine, taking a disc out, removing this part of the disc so that we can take pressure off the spinal cord, or removing a broken bone from this area from the front, works really well. That allows us to take pressure off the spinal cord without actually even touching it. So the anterior approach is often used in the cervical spine. When we come from behind, we can put screws and rods into areas along the spine and stabilize it, or do a laminectomy. And there are some circumstances where posterior approaches to the cervical spine are very useful. The key to the whole process is that depending on where the pathology is or where your problem is, dictates which is the best way to approach your spine, but we can do a fusion, if we need to, from either direction. If bone problems include osteoporosis or a severe injury, sometimes we have to do both. Now, when we're talking about treating the thoracic spine or the lumbar spine, we can talk about the same kinds of approaches. The posterior approach in these surgeries is the most traditional, the most common, and we use it to treat instability, fractures, disc degeneration and herniations, or deformities such as scoliosis or instability. This is the most useful approach for taking pressure off of nerves in the lumbar spine. So while we do the surgeries in the cervical spine from the front, we're most often going to address the lumbar spine from behind. So this is the posterior approach, but we can, in certain circumstances, do an anterior approach by doing a special kind of incision and approaching the abdomen through the front. We can get to the front of the lumbar spine and do disc removal or fusion surgery from that approach. And when we have to treat more serious conditions like tumors and infections, oftentimes we need to do both of those approaches to get where we need to be. The key thing is that after removing bone, we can put bone graft or struts or instrumentation in here, but the long-term success of any of these operations depends on obtaining a solid fusion of one level to the next so the spine will be stable and strong. So the most important question for you as a patient is, does fusion work? Does it relieve pain? Does it protect the spine? Does it get you back to good function and activity? Well, the long-term answer is yes. When it's done right for the right kinds of problems, spinal fusion surgery is very effective at reducing back pain, neck pain, arm and leg pain, and restoring function, getting you back to where you can do exercise, where you can get back to work, where you can do the things that make life worthwhile. So if your back and neck pain are caused by either a deformity or instability of the spine, if there's severe disc degeneration and deterioration of the spinal column, or if you need a surgery that's going to remove important structural components of the back and the spine, and if non-operative care hasn't worked for you, then spinal fusion surgery makes sense. And it may be the number one thing that you can do to get back to good function and good activity. Another question you should be asking, if you're the patient that's going to require fusion, is what can you expect after the fusion's completed? Well, after a successful fusion, once the bone has healed and once the bone has grown from one level to the other, the spinal instrumentation and the implants are just redundant. Your bone is now going to hold your spine stable for the rest of your life. Once a fusion is solid, patients can go back to exercise. They can go back to sports and even heavy work. And they can get back to an active lifestyle, particularly if they're willing to put in the work to get their muscles back in shape. That's one of the toughest things after a fusion, is getting the rest of your body back to a rehabilitated state. Physical therapy, rehabilitation after surgery, all of these things are important to getting the very best result. Our goal with any kind of surgery, but particularly after a fusion surgery, is good function. My patients are the happiest when they can get back to exercise and activity. They're able to go back to work at home or at the job, and they're able to stay fit and do the things that make life worthwhile. So, here's the important point. If back pain, your back pain, is due to mechanical instability or severe disc-related problems, and if other simpler treatments haven't helped, a carefully planned and performed spinal fusion can be the best solution for you. Well, I hope you found this discussion informative and interesting, and that you've gotten something good out of it. I want to thank you for watching. But if you have more questions about good back health, back and neck care, or if you're a patient in this particular area and you need to see somebody for your own back or neck problems, please give me a call at the number below. That's 800-670-0302. And if you want to know more about back care, back surgery, or other kinds of procedures, feel free to check out my website at spinesurgerycleveland.com. That's spinesurgerycleveland, no spaces, .com. Hey, thanks for listening, and thanks for watching.